Most seniors believe brain problems appear suddenly, but in reality the brain almost always sends quiet warnings long before a major event occurs. Brain circulation does not shut down overnight. It slowly weakens, giving subtle signals that are easy to dismiss as normal aging. After 60, even small reductions in blood flow can affect thinking, balance, vision, and emotional stability more than most people realize. Many seniors are told forgetfulness, dizziness, or fatigue are harmless signs of getting older, so they learn to ignore early brain warnings. This belief is dangerous because the brain depends on constant rich circulation to function safely and independently. In fact, the brain uses nearly 1/4 of the body's total blood supply every single moment. When circulation drops even slightly, brain cells struggle to receive enough oxygen and nutrients. This struggle often shows up as mental fog, slowed thinking, or strange balance issues. Because these changes happen gradually, they rarely feel urgent at first. That is why so many serious brain events seem sudden, even though warning signs existed for months or years. The most dangerous brain circulation problems are often the quietest ones. They do not cause sharp pain or dramatic symptoms that force immediate attention. Instead, they whisper through small daily changes that are easy to explain away. After 60, ignoring these whispers increases the risk of stroke, falls, and loss of independence. The good news is that recognizing early brain circulation problems gives you power. Awareness allows action before damage becomes permanent. Today, I want to walk you through the most important brain circulation problems seniors should never ignore. These are signs I see repeatedly in older adults long before major neurological emergencies occur. As we go through them, you may recognize experiences from your own daily life. That recognition is not meant to frighten you, but to protect you. Before we continue, take a moment to tell me where you are watching from today. Also, let me know your age, because brain circulation changes differently across senior years. Many people around the world share these experiences without realizing their meaning. You are not alone, and you are not imagining these changes. Let's begin by listening closely to what your brain may already be trying to tell you. To understand why these subtle brain warning signs appear so often after 60, we first need to look at the biological changes that make the aging brain more vulnerable to reduced circulation. After 60, blood vessels supplying the brain gradually stiffen, reducing their ability to expand quickly when the brain suddenly needs more oxygen and nutrients. This stiffness limits adaptive blood flow, especially during position changes, mental effort, or sudden movements that require rapid circulation adjustments in older adults. Aging also reduces nitric oxide production, a molecule essential for keeping cerebral blood vessels relaxed and responsive throughout the day. With less nitric oxide available, brain arteries remain slightly constricted even at rest, quietly lowering baseline circulation over time. Small vessel disease becomes more common after 60, affecting tiny capillaries that deliver blood directly to brain tissue. These microvessels are critical because even mild blockages can impair localized brain function without obvious symptoms. Blood pressure regulation also becomes less stable with age, leading to fluctuations that strain delicate brain circulation systems. Sudden drops or spikes in blood pressure can briefly reduce cerebral perfusion, especially when standing or waking during the night. Nighttime dehydration further thickens blood, making it harder to flow smoothly through already narrowed brain vessels. This explains why many strokes and brain events occur in the early morning hours among seniors. Chronic inflammation increases with age, subtly damaging blood vessel walls and reducing their efficiency in supplying the brain. Inflammation also accelerates plaque buildup, further narrowing arteries that feed critical brain regions. The brain has limited energy reserves, so even short periods of reduced circulation can affect thinking, balance, and coordination. Unlike muscles, brain cells cannot easily rest or regenerate after repeated low-oxygen stress. Medications commonly used after 60 may also influence cerebral blood flow, sometimes lowering pressure too much or altering vascular tone. When multiple age-related factors combine, The brain operates closer to its minimum circulation threshold. This leaves little margin for error during stress, illness, dehydration, or sudden movements. The result is increased vulnerability to dizziness, confusion, and balance problems that seem unexplained. These changes do not mean damage has already occurred, but they signal reduced resilience in brain circulation systems. Understanding this biology helps explain why early awareness is critical for protecting brain health and independence after 60. Now that you understand why the aging brain becomes more vulnerable to reduced blood flow, let's look at the 8 specific brain circulation problems seniors should never ignore, starting with the most easily overlooked signs. Number 8. Morning brain fog or slow thinking. Morning brain fog or slow thinking often feels harmless, yet it can signal reduced cerebral blood flow after sleep, especially in seniors over 60 years. After waking, the brain requires rapid circulation increases to restore alertness, memory retrieval, and coordination, which aging vessels may struggle to deliver consistently each morning. Seniors often blame grogginess on poor sleep, but persistent morning fog can reflect overnight dehydration, blood thickening, and narrowed vessels limiting oxygen delivery to neurons. During sleep, circulation naturally slows, and if vessels cannot rebound efficiently upon waking, thinking speed and clarity may lag noticeably for several minutes each day. This fog often lifts later, misleading seniors into dismissing it, yet repeated morning deficits suggest chronic underperfusion rather than temporary tiredness within the brain tissue. Reduced nitric oxide with age limits vessel dilation, making it harder to rapidly increase blood flow when the brain transitions from rest to activity states. Morning brain fog may accompany slower word finding, delayed reactions, or trouble focusing, subtle signs seniors may overlook despite daily repetition during routine tasks home. Because symptoms improve after breakfast or movement, many assume food or caffeine solved the issue, masking an underlying circulation vulnerability that persists each early morning. In reality, nourishment temporarily boosts flow, but it does not correct stiff vessels or impaired microcirculation supplying critical brain regions responsible for attention memory control. Over time, repeated low morning perfusion can contribute to cumulative cognitive strain, increasing risks for falls, errors, and later neurological events during daily activities alone. This pattern differs from normal sleepiness because it consistently appears upon waking and resolves only after circulation gradually improves with time, hydration, movement, and meals. Seniors should note how long fog lasts, what improves it, and whether balance or vision feels slightly off simultaneously during early morning household activities alone. Tracking these details helps distinguish harmless grogginess from circulation-related brain stress that deserves attention, especially when patterns repeat daily despite adequate sleep, hydration, and nutrition. Morning fog is often the earliest signal, giving seniors a chance to act before more dangerous symptoms appear such as dizziness, imbalance, memory lapses develop. Ignoring it allows vascular stiffness and microvessel dysfunction to progress quietly, reducing resilience during stress or illness later in the day and overnight periods repeatedly. Simple observations made consistently can guide safer habits and timely conversations with healthcare providers about hydration, sleep, blood pressure medications, and circulation-related brain changes. Morning brain fog should prompt curiosity, not panic, encouraging seniors to support circulation rather than dismiss symptoms that recur frequently after waking each new day. Addressing hydration, gentle movement, and breakfast choices can reduce fog, while broader circulation issues are evaluated over time by monitoring patterns, symptoms, and responses carefully. This sign ranks lower because it is subtle, yet its persistence makes it a valuable early warning for detecting cerebral circulation decline before severe events. Next, we will examine another overlooked problem that reveals how posture and blood pressure changes affect brain circulation during standing transitions in older adults daily. Number 7. Dizziness or lightheadedness when standing. Dizziness or lightheadedness when standing is often brushed off, yet it commonly signals a brief drop in blood flow to the brain. After 60, blood vessels react more slowly to position changes, making it harder to maintain steady cerebral circulation when standing up. This condition is often linked to orthostatic hypotension, where blood pressure falls momentarily before the body can compensate adequately. Seniors may feel a head rush, blurred vision, or brief unsteadiness that fades within seconds, encouraging them to ignore the episode. However, even short episodes indicate that brain perfusion is temporarily insufficient during posture transitions. The brain relies on rapid vascular adjustments to keep oxygen delivery stable during movement. With aging arteries, that adjustment becomes delayed or incomplete. Dehydration, common overnight, further reduces blood volume and worsens lightheadedness upon rising from bed or chairs. Certain medications after 60 can amplify this effect by lowering blood pressure or blunting vascular reflexes. Repeated dizziness episodes increase fall risk, especially during nighttime bathroom trips or early morning routines. Many seniors adapt unconsciously by standing slowly, masking the seriousness of the underlying circulation problem. This adaptation does not fix the cause. It only reduces immediate symptoms. Persistent lightheadedness suggests the brain is frequently operating near its minimum circulation threshold. Over time, repeated low perfusion stresses brain tissue and impairs balance control systems. Seniors may notice increased fear of standing quickly or walking confidently without understanding why. This symptom often appears alongside fatigue, blurred vision, or morning brain fog. Tracking when dizziness occurs helps identify patterns related to hydration, meals, or medication timing. Lightheadedness is not simply getting up too fast. It reflects circulation vulnerability. Recognizing this sign early allows safer adjustments before serious falls or neurological events occur. Next, we will discuss a subtle communication problem that reveals reduced blood flow to language and processing centers in the brain. Number 6. Trouble finding words or delayed speech. Trouble finding words or delayed speech is often dismissed as harmless forgetfulness, yet it can signal reduced blood flow to language centers in the aging brain. After 60, the brain's language networks require steady circulation to retrieve words quickly during conversation and everyday communication tasks. When circulation weakens, word retrieval slows, creating pauses where seniors know what they want to say but cannot access it immediately. These pauses may feel embarrassing but brief, leading many people to laugh them off and move on without concern. However, repeated difficulty suggests the brain is struggling to deliver oxygen efficiently to areas responsible for speech processing. Language centers are highly sensitive to even small drops in blood flow compared to other brain regions. Reduced nitric oxide and stiffened vessels limit rapid blood delivery during active conversation or mental effort. Seniors may notice speech delays worsen when tired, dehydrated, or stressed, all situations that further reduce cerebral circulation. This problem often appears intermittently, which makes it easier to ignore and harder to connect to circulation issues. Family members may notice increased hesitation, simplified sentences, or avoidance of longer conversations over time. Delayed speech can also occur alongside brain fog or fatigue, reinforcing the circulation connection. Unlike lifelong speech patterns, these changes feel new and subtly progressive. Because they do not cause pain, seniors rarely report them during routine medical visits. Over time, persistent underperfusion can weaken communication confidence and social engagement. This withdrawal may mistakenly be attributed to personality changes rather than neurological stress. Trouble finding words is not simply aging vocabulary loss, but a sign of slowed neural signaling. The brain requires rapid blood flow adjustments to support speech timing and precision. When those adjustments fail, delays become noticeable even in familiar conversations. Recognizing this sign early allows attention to hydration, blood pressure, and circulation health. Next, we will examine how balance and walking problems often reveal deeper brain circulation challenges seniors should never ignore. Number 5. Balance problems or unsteady walking. Balance problems or unsteady walking are often blamed on weak legs, aging joints, or poor eyesight, but they frequently originate from reduced blood flow to balance centers. After 60, the brain areas controlling balance and coordination become highly sensitive to even brief drops in circulation. Walking requires constant communication between the brain, inner ear, nerves, and muscles, all dependent on steady cerebral blood flow. When circulation falters, timing between these systems becomes slightly delayed, creating a feeling of instability while standing or walking. Seniors may describe this as feeling off balance rather than dizzy, making it harder to explain or recognize as a warning sign. These balance changes often appear during turns, uneven surfaces, or when walking in low light conditions. Reduced blood flow to the cerebellum and brainstem can impair fine motor control without causing obvious weakness. Because strength feels intact, many seniors assume the problem is minor or temporary. Over time, repeated circulation stress makes balance systems less reliable, increasing fall risk gradually rather than suddenly. Many falls occur not from tripping, but from brief loss of coordination during routine movements at home. Unsteady walking may worsen when tired, dehydrated, or after long periods of sitting. These triggers further reduce cerebral perfusion at moments when balance demands increase. Seniors often adapt by walking slower or holding furniture, masking the progression of the underlying issue. Adaptation reduces immediate danger but does not restore healthy brain circulation. Balance problems linked to circulation often accompany brain fog or lightheadedness. This combination suggests the brain is not receiving consistent oxygen delivery. Ignoring these signs allows further decline in confidence and independence. Early awareness gives seniors a chance to address circulation before serious injury occurs. Walking confidence is a key marker of brain health after 60. Next, we will explore how unexplained fatigue can reflect deeper circulation problems affecting the aging brain. Number 4. Vision changes or brief visual disturbances. Vision changes or brief visual disturbances are often blamed on eye aging, yet they frequently reflect reduced blood flow to visual processing areas in the brain. The brain's visual cortex requires a constant, rich blood supply to interpret images clearly and maintain stable vision during movement. After 60, even short interruptions in cerebral circulation can cause momentary blurring, dimming, or difficulty focusing visually. Some seniors notice flashes, shadowy spots, or brief narrowing of vision that resolve quickly and seem harmless. Because these episodes pass within seconds or minutes, they are often ignored or forgotten soon afterward. However, transient visual disturbances often indicate temporary underperfusion of critical brain regions. The eyes may be healthy, yet the brain struggles to process visual signals efficiently due to reduced oxygen delivery. Stiffened arteries and narrowed microvessels limit rapid blood flow increases when visual demand rises. These changes may appear during standing, walking, or sudden head movements. Visual disturbances can also worsen during dehydration, fatigue, or low blood pressure episodes. Many seniors notice difficulty adjusting to changes in light, especially moving from dark to bright environments. This delay reflects slowed neural processing linked to circulation challenges rather than eye disease alone. Repeated episodes increase strain on visual pathways and coordination systems. They may also contribute to balance problems, increasing fall risk indirectly. Visual disturbances often accompany dizziness or brain fog, strengthening the circulation connection. Ignoring these signs allows vascular stress to persist unnoticed. Early recognition helps differentiate eye issues from brain circulation problems requiring attention. Vision symptoms without eye pain deserve careful observation in older adults. Clear vision depends on healthy brain circulation, not just healthy eyes. Next, we will examine how unexplained mental or physical fatigue can signal reduced blood flow to the aging brain. Number 3. Sudden fatigue or mental exhaustion. Sudden fatigue or mental exhaustion often appears without warning, making seniors feel drained even after light activity or simple mental tasks. This type of fatigue is different from normal tiredness because it arrives quickly and does not improve with short rest. After 60, the brain's energy demand remains high, but circulation struggles to meet that demand consistently. When blood flow dips, brain cells receive less oxygen, forcing the brain to slow down to protect itself. This slowdown feels like overwhelming fatigue, heavy thinking, or inability to concentrate clearly. Many seniors describe it as the brain shutting down unexpectedly during routine daily activities. Because no pain is involved, this fatigue is often blamed on aging, stress, or poor sleep. However, repeated mental exhaustion often reflects chronic cerebral underperfusion rather than simple lifestyle factors. The brain uses more energy than any other organ, making it extremely sensitive to circulation changes. Even brief reductions in blood flow can trigger sudden energy loss and mental heaviness. This fatigue often worsens after meals, dehydration, or prolonged sitting, when circulation dynamics shift unfavorably. Seniors may notice they need frequent breaks from conversations, reading, or decision-making. Over time, this pattern reduces confidence and limits social engagement. Mental exhaustion linked to circulation often appears alongside brain fog or slowed thinking. These combined symptoms suggest the brain is operating close to its minimum energy threshold. Ignoring this sign allows repeated low oxygen stress on brain tissue. That stress accumulates quietly, increasing vulnerability to more serious neurological events. Sudden fatigue is the brain's way of signaling insufficient support. Listening early allows corrective habits before damage progresses. Next, we will explore how poor wound healing reflects circulation problems that also affect brain health. Number 2. Memory lapses that feel different from normal aging. Memory lapses that feel different from normal aging often create unease because they appear suddenly and do not match long-standing forgetful patterns. These lapses may involve losing track of familiar routines, repeating questions, or momentarily forgetting why you entered a room. Unlike ordinary aging, these moments feel sharper, more confusing, and harder to explain afterward. After 60, memory relies heavily on consistent blood flow to the hippocampus and frontal brain regions. When circulation weakens, memory retrieval becomes unreliable, even if stored information remains intact. Seniors may sense that the memory is there, but access to it feels blocked or delayed. This experience often worsens during fatigue, dehydration, or after poor sleep. Because memory later returns, many people dismiss these lapses as harmless. However, fluctuating memory is a classic sign of inconsistent cerebral blood flow. The brain needs steady oxygen delivery to maintain clear recall and orientation. Small vessel disease can interrupt communication between memory centers without causing obvious damage. This leads to on-again, off-again memory performance that feels unpredictable. Family members may notice increased repetition or subtle confusion in conversations. These changes often coexist with brain fog or slowed thinking. Together, they point toward circulation stress rather than simple forgetfulness. Ignoring these signs delays opportunities to protect brain resilience. Early awareness allows lifestyle and medical factors to be reviewed safely. Memory lapses linked to circulation often progress if unaddressed. Recognizing the difference between aging and warning signs is crucial. Next, we will discuss the most dangerous signal of all: sudden balance problems and near falls. Number 1. Near falls or sudden loss of coordination. Near falls or sudden loss of coordination are among the most serious brain circulation warnings, often appearing just before dangerous injuries or major neurological events. These moments may feel like your body briefly stops obeying your intentions, even though your muscles still feel reasonably strong and responsive. After 60, balance and coordination depend heavily on uninterrupted blood flow to the brainstem and cerebellum. When circulation drops suddenly, these control centers cannot synchronize movement, posture, and reflexes effectively. Seniors often describe near falls as feeling pushed, pulled, or suddenly unsteady without any clear external cause. Because no actual fall occurs, these incidents are often minimized or forgotten quickly. However, near falls indicate the brain briefly lost precise control over movement timing and spatial awareness. This loss is rarely caused by aging alone and usually reflects momentary cerebral underperfusion. Even a few seconds of reduced blood flow can disrupt coordination dramatically. These episodes frequently occur during turns, stepping off curbs, or navigating tight spaces at home. Nighttime and early morning are especially risky due to dehydration and blood pressure fluctuations. Repeated near falls increase fear of movement, leading to reduced activity and muscle deconditioning. That deconditioning further worsens balance, creating a dangerous downward spiral. Family members may notice increased caution, slower walking, or reliance on furniture for support. Sudden coordination loss is a strong predictor of future falls and injuries. Falls are one of the leading causes of loss of independence in seniors. Near falls are not random accidents, but critical warning signals from the brain. Ignoring them allows circulation instability to persist and worsen. Early recognition gives a chance to protect mobility, confidence, and safety. When the brain signals danger this clearly, it should never be ignored. Now that you've seen how these brain circulation problems quietly show themselves, the next step is learning how to respond safely and protect your brain before those warnings turn into real harm. Once you recognize the warning signs of reduced brain circulation, the most important response is not fear, but calm, informed, and safe action. After 60, the brain does not need extreme changes. It needs consistency, awareness, and protection from unnecessary stress. A safe action framework begins with listening to your body instead of pushing through symptoms or explaining them away. The first step is tracking patterns, not moments. Pay attention to when symptoms appear, how long they last, and what makes them better or worse. Patterns over days and weeks are far more meaningful than any single episode. Next, stabilize the foundations that support brain circulation. Adequate hydration throughout the day helps blood remain fluid and flow more easily through small cerebral vessels. Regular balanced meals prevent sharp drops in blood sugar that can strain brain energy and circulation. Sleep safety is a critical part of this framework. Consistent sleep timing and avoiding nighttime dehydration reduce early morning circulation stress when the brain is most vulnerable. Another key principle is slow, deliberate movement. Standing up gradually, especially in the morning or at night, gives blood vessels time to adjust and maintain cerebral perfusion. Gentle, regular movement is safer and more effective than intense, irregular exercise. Easy walking, simple balance work, and deep breathing support blood flow to the brain without overloading aging systems. If you take blood pressure, heart, or diabetes medications, observe how symptoms relate to timing and dosage. Do not adjust medications on your own, but record observations to discuss clearly with your healthcare provider. A safe action framework also means knowing when to seek help promptly. Sudden speech difficulty, severe dizziness, new vision changes, or clear loss of coordination should never be ignored or delayed. Above all, remember that after 60, safety matters more than perfection. The goal is not ideal numbers on paper, but stable balance, clear thinking, and daily confidence. Early, gentle, and consistent actions give the brain the best chance to adapt and recover. Listening to small signals today is how seniors protect independence, mobility, and clarity for years to come. With these warning signs understood and a clear plan for safe action in place, it's time to step back and focus on what all of this truly means for your independence, confidence, and quality of life moving forward. Brain circulation problems do not appear overnight, but they quietly develop over years, giving seniors many chances to notice warning signs and protect independence early. After 60, listening to subtle symptoms is not fear-based thinking, but practical wisdom that allows the brain time to recover and remain resilient long-term stability. Small daily signals like balance changes or mental fog are not inconveniences. They are messages asking for attention before serious damage occurs within the brain. Recognizing these signs early gives seniors power, because action taken gently and consistently is far more effective than reacting after a crisis has already happened. Protecting brain circulation is not about fighting age, but about supporting blood flow that allows thinking, movement, and confidence to stay strong each single day. You do not need extreme treatments to begin, only awareness, steady habits, and the willingness to take warning signs seriously without panic, fear, or delay. Simple steps like hydration, slow movement, and sleep awareness can meaningfully reduce strain on vulnerable brain vessels over time for aging bodies every single day. Safety after 60 means choosing stability over speed, balance over pressure, and long-term clarity over short-term reassurance that often fades quickly without addressing real causes. These principles are not restrictive, they are freeing, because they help seniors move through life with less fear and more confidence each passing year ahead. Sharing this information can quietly change outcomes, helping families recognize danger sooner and support loved ones before independence is lost becomes fragile, uncertain, and frightening. If these signs felt familiar, take that recognition as an opportunity, not a diagnosis, and begin paying closer attention to patterns, timing, triggers, symptoms daily. Awareness today allows prevention tomorrow, and prevention is always gentler than recovery after serious neurological events that permanently alter balance, memory, independence, confidence, safety, life. Your brain has supported you for decades, and it deserves the same patience, care, and respect now, as your needs change with age, time, experience. Staying independent is not about ignoring weakness, but about responding early when the body asks for help through signals, symptoms, patterns, consistency, patience, wisdom, awareness. Every senior deserves to walk confidently, think clearly, and live without constant fear of sudden loss of control over balance, memory, movement, safety, dignity, independence. These outcomes begin with understanding, not denial, and with small actions repeated daily rather than dramatic changes that overwhelm the body, mind, systems, stability, safety. If this message resonated, consider leaving a comment sharing your age and which sign stood out most in your daily life, routines, experiences, lately, honestly. Your voice may help another senior realize they are not alone in noticing these quiet changes occurring within their own body, mind, balance, confidence, independence. Please share this video with someone over 60 who might benefit from understanding these warnings earlier than later, before falls, strokes, injuries, confusion, loss occur. We do not wait for disaster. We listen when the brain whispers and act with care, consistency, patience, awareness, wisdom, respect, courage, safety, balance, life. Thank you for spending this time with me today, and I look forward to continuing this journey together in the next video as we keep learning how to protect our health after 60.